been struck by a car. There's significant chest wall trauma evident on the right, with crepitus on chest wall exam and decreased breath sounds. The child's blood pressure currently is 60/40. He is moaning audibly with no evidence of airway obstruction. So, what would our answer be for the next best step? Would you obtain a CT of the chest and abdomen? Would you obtain an echocardiogram? Would you do a chest tube? Would you do a needle thoracostomy? Or would you do an intubation? So, this is a very easy question. For a 10-year-old child, if you're noticing crepitus on exam and you're noticing chest wall trauma, there's it's very likely that this child has a tension pneumothorax, because there are decreased breath sounds as well and there is decreased blood pressure. So when tension pneumothorax occurs, what happens is that there is air entry into the chest wall cavity, right? So excessive air has accumulated there and that's compressing the lung, and as the air is increasing, it's also compressing the heart. So if the heart is compressed, the venous return to the heart, that is the blood that is being returned from the body to the heart, is reduced. If it's reduced, that will lead to hypotension. So all the symptoms here, like the decreasing of breath sounds and the crepitus on exam, are indicative of tension pneumothorax. Would you obtain a CT scan? I mean, even if you were concerned for bleeding because of the hypotension, the first step that you would likely do would be an ultrasound. CT scan takes too much time. It's not the most best indicated thing when somebody has any trauma, because it takes a lot of time and you'll lose valuable time doing that. Echocardiogram, if you were concerned for a pericardial effusion. Now, even in that case, the person can be hypertensive due to decreased venous return. But the crepitus that we are noting on this exam and the decreased breath sounds, that's more indicative of a tension pneumo. So we wouldn't do an echocardiogram first. We might eventually do that to see if there is like any underlying lesion to the heart as well, but that wouldn't be our first step. Coming to chest tube, again, that won't be our first step. It will eventually be indicated in the case of a tension pneumo, but that would be following the next step, which is the needle thoracostomy. So if you do a needle thoracocentesis, you push a needle in, you take the excess air out of the chest wall cavity. That gives room for the lung to expand again, for the heart to expand again, and then the child will be able to breathe better, will be able to perfuse, like the blood in his body will be able to flow better, because his heart is in the regular shape and size that it was before. So that would be the first step that you would do to save this child's life. The next step after that would be a chest tube. And would you intubate this child? So I used to earlier think that intubation would be the next best step, because we want to maintain an airway for this child. But if you add anything to the chest cavity, which is already so filled with air that it's compressing its contents, like the lungs and the heart, and intubation would be compressing things even more, because it's an addition, right? It's the addition of an endotracheal tube. It's discomfort to the child. So it's not indicated right now. Let's say we do a needle thoracocentesis and this child does not gain their proper lung function, does not, their oxygen doesn't stabilize, then we might do an intubation in the future, because there might be some underlying other cause, or the trauma would be to the lung tissue and not to the chest cavity. So in that case, intubation would be indicated, but not before a needle thoracocentesis.